Good morning, and a huge welcome to this scientific conference, Data Insights in a Pandemic. And thank you for making time out of incredibly busy diaries to join us today. My name is Andrew Morris. I'm Director of Health Data Research UK. And it's a huge pleasure on behalf of Caroline Cake and the team across the UK to welcome you to what we think is a fantastic day of science ahead of us with 70 outstanding contributions. And I'm delighted to say that we've got over 1,500 delegates from 68 countries joining us, and it really is an A to Z of the world. Colleagues from Afghanistan, Australia, Ecuador, Gambia, all the way through to Ukraine, Somaliland, and Zimbabwe. So a huge welcome to you all. And I think a particular warm welcome to our friends from Croatia, who played very well last night, sadly, but well done indeed. So I just want to briefly set the scene and give you a taster of what we have on offer today. And a day that has really brought outstanding scientific talent together across the UK, covering ethics, biomedical science, viral genomics, public engagement, and clinical trials, and many other things. So to move on, I would like to thank our event partners, not only for supporting us today, but also for working in partnership over the last 12 months and beyond. And you'll see that specific sessions are sponsored by many of our partners. So I just want to set the scene. What brings us together today? The WHO dashboard from Midsummer's Day suggested that globally we have over 178 million people affected with COVID-19, and very sadly, over 3.6 million deaths. And it's estimated that 2.4 billion people have received a first dose of vaccine. But as you know, specifically for the mortality estimate, that is probably an underestimate. And The Economist indeed suggests that the global burden is probably over 10 million deaths. But today we want to focus on the science. How has science galvanized around the pandemic? Next slide, please. So I would argue that what we've seen is remarkable innovation. New technology platforms for vaccine delivery. Secondly, we've seen speed of innovation never seen before. Vaccines approved within months rather than decades. Thirdly, we've seen collaboration arguably never seen before, over 100,000 articles published on COVID-19. And lastly, we've seen a new approach to assessing effectiveness and safety of medicines, for example, the recovery trial, which we'll hear today. What we've also seen is a new way of working together. So this slide shows the daily active users of Zoom in the UK. At the beginning of March last year, it was only 69,000 users of Zoom in the UK per day. Now it's plateaued at 1.7 million meetings today. And I must say, at times, I feel I've attended most of them. The next slide, please. So HDR UK has had the privilege of working in partnership with many partners across the UK. Our mission is to unite the UK's health data to enable discoveries that improve people's lives and run studies on up to 66 million people. And to do that, our thesis is that one needs to unite health data, improve health data, and use data to create a trustworthy health data ecosystem with public engagement and transparent governance. And if we're able to do that, we will see an ecosystem developing and a sector maturity developing, moving along away from the bilateral relationship between data custodians and researchers to a many-to-many relationship where many data custodians collaborate and enable research from multiple researchers and innovators executing research that's in the public interest. Next slide, please. And key to this is partnership across the UK, and we're very privileged to work across all four nations, across NHS, academia, government, third sector, and philanthropy. Next slide, please. And a key driver of this is an alliance, the UK Health Data Research Alliance, under the stewardship of David Seymour, which has brought together data controllers across the UK, whether they're in the NHS, academia, whether they're in the charitable sector, to work together to look at that interoperability. How do we work across organizational boundaries in a trustworthy way to do great science with no additional effort? Next slide, please. And part of that is to demonstrate trustworthiness, and all credit to our colleagues at HDR UK and ONS who coined the phrase the 5 safes framework. How can safe people work on safe projects that are in the public interest, on safe data in safe settings with safe outputs, so that we demonstrate trustworthiness? Next slide, please. So the 5 safes and trustworthiness is a golden thread, which I think you'll see through the program today. Next slide, please. And enabling discovery of data and so-called fair data services, so data are findable, accessible, interoperable, and reusable, is essential. And over the past year, we've worked with partners to enable the UK Health Data Research Innovation Gateway, available for anyone to search data sets that are available across the UK for research and innovation, but it searches on the metadata, so there's no personal identifiable information, but it promotes transparency and it promotes collaboration at scale. So let's just briefly touch upon the pandemic. It is now precisely 470 days since the WHO declared the pandemic on the 11th of March 2020. What's happened in the UK during those 470 days? Well, what we saw initially was a need for coordination. In terms of research, there was lots of fragmented research activity. It was very difficult to access data, to answer key questions related to policy and questions that system leaders needed to answer. And we had no way of prioritizing the research questions, which we thought were really, really important. So next slide, please. So working in partnership with Sage, Patrick Vallance, but with colleagues across the UK, all members of the UK Health Data Research Alliance, we were able to send a spotlight on how health data research was enabling the pandemic response in the UK at scale. And that has resulted in over 1,400 outputs, and we convened a community of over 700 researchers working on 300 projects. And can I just flag the amazing contribution of many new COVID-specific initiatives, whether it's COG UK, Open Safely, Genomic, Eve2, ISARIC 4C, or Recovery, all with great acronyms that have really shone a light on key facets of this pandemic. And they're all on the program today. So the SAGE reports, 38 of them, are all available on the SAGE and the HDR UK website. But what we're beginning to see is a mapping of data across the UK, across the 4 nations, in ONS, NHS Digital, Scotland, Wales, and Northern Ireland, to really promote the use of data in a trustworthy way for research purposes. And part of that is the 5 safes framework, and I'm delighted today we have several sessions which will demonstrate the added value and the importance of patient and public involvement throughout everything that we do. So I just want to give you a flavour of some of the national research outputs, and many of these are on the programme today, so please do, it's a potpourri, so please do dip in to whatever interests you. So first of all, trials. We've got Martin Landry, who alongside Peter Horby and the remarkable NIHR Clinical Research Network led on the recovery trial. So there's a session on recovery today, which, as you know, is the largest global randomized trial of patients during the COVID pandemic. Working with Chris Butler in Oxford, we linked up test and trace data with public engagement to accelerate recruitment to the principal trial. Recruitment in the community can be really tricky, but within 24 hours of a positive test, citizens across the UK now are being invited to participate in the principal trial. Not only important for treatments of COVID, but in the future for treatment of for trials of antivirals. In terms of safety, the work of Aziz Sheikh, Jim McMenamin on the EVE-2 trial, a nationwide study published in The Lancet and Nature Medicine on the safety and effectiveness of the AZ and Pfizer BioNTech vaccine, which has guided government policy, we estimate, in at least 8 countries. So again, there's a session on EVE-2 today. And the work of the BHF Cardiovascular Data Science Centre, which alongside Open Safely now can run studies on populations of over 50 million people to look at the safety and the effectiveness and the benefits of treatments in COVID-19. And not to forget our colleagues in Wales, who arguably have the most sophisticated data linkage across the UK, colleagues such as Ronan Lyons, David Ford, have enabled total population data linkage for the population of 3.2 million folk in Wales, which has demonstrated the impact of the pandemic in non-COVID related issues. For example, the educational scarring of COVID, the effect on surgical morbidity and mortality, as well as non-COVID harm and the effect of COVID on the care home population. And in this plenary session, we'll be hearing from Sharon Peacock, who has, with colleagues, led the largest viral genome tracking effort in the planet, with over 550,000 viral genomes sequenced. Viral sequencing has come of age and has now demonstrated its utility for care at scale across the globe. And just to demonstrate that team science is about people, this is the list of the folk who've contributed to COG UK. Team science is transformative, and COG UK is a fantastic example of team science at scale. So to summarize, what have we learned during the last 470 days since WHO declared COVID as a pandemic? Data is key, and if we use it well in a trustworthy way, it can help save lives. Getting value from data requires collaboration at scale, the ability to work across organizational boundaries with no additional effort. And that's the game that HDR UK is trying to enable. And recognizing and respecting skills of the team, the patients, the ethicists, the scientists, the trialists. How do we bring the community together? And lastly, working with the publics is absolutely essential. They make the science better. So next slide, please. So to summarize, I would argue that what this pandemic has taught us as we build trustworthy health data research ecosystems, it's about coordination and connectivity, not command and control. Trustworthiness needs to be woven through everything we do as a golden thread. It's important to think about that pre-competitive stuff, the governance infrastructure, the standards, the data services, as part of a network of federated, trusted research environments, the importance of team science. And if we get this right, it will advance open science practice internationally. So what you'll hear today is some outstanding speakers. These are just few of the 70 folk who are contributing. I would And this is truly global. Agnes Binagwaho and YY are joining us from Singapore, Rwanda, as well as Camilla from Norway, as well as outstanding UK and European talent. So I'll finish by saying and quoting the Wall Street Journal. I'm an avid reader. The new Einsteins will be the scientists who share. And I think that if we can take team science forward as the standard for biomedical and clinical research, we will be doing the citizens of the world a great favor. So I'm going to finish there, but just very briefly before we crack on, some housekeeping. So there are 1,500 of us here today, so we want at least a question from every one of you. So please ask a question. There's a function allowing you to do that. The agenda section will allow you to choose which sessions you want to join, and you can flip between sessions as you see fit. Please do use the message wall. We'll be collecting the information from today and publishing the outcomes from the symposium. And if you need help, press the help tab. I don't need to do a fire drill, which is good. So it's fantastic to have you all here today. And what we're going to do, I'm not going to take questions, but what I'm going to do is introduce our next speaker, who's Margaret O'Hara. And it's right and proper that we start this conference with the patient perspective. So Margaret is a patient representative who's helped HDR UK over many, many years, and she's also the founding member of the Long COVID Support Group. So I'm going to invite Margaret to the platform. Welcome, and she's going to tell us about Leave No One Behind. So over to you, Margaret.